One is pleased to welcome Dr. Jeffrey Benger, Chairman and Chief Executive Officer of Summit Health Management and the Summit Medical Group. Good to see you, Jeff.
Thank you for having me here.
A whole range of issues I want to talk to you about, but the first area, let's talk a little bit about oral health, a subject that doesn't get a lot of attention. You were just telling me that your specialty is in the area of?
Ear, nose, and throat, otorhinolaryngology.
What is the connection between our oral health, right, and some other issues medically, health-wise, that you would never think would come up?
Well, a few things. One, as the population ages, a lot of people who are in the Medicare distribution do not have dental care in their policies. And as you age, oral care is extremely important. It could lead to infection, it could lead to systemic infections, and you have to take care of oral care. Also with cancer care. There are aspects of cancer care where you might need to have something called radiation therapy.
Radiation therapy.
Correct, where a radiation beam is given to that individual to treat the cancer. And if it's in the head and neck region, if you have dental caries or poor health, gum disease, when you give that radiation therapy, it can cause serious side effects. So it is very important for the elderly to have good oral hygiene and good oral care.
Make the connection. I know you have a partnership, a collaboration with Delta Dental. Explain what that is and why it's relevant for the audience watching right now.
Right. So we are talking with Delta Dental right now with our Medicare product. Medicare is a product for age 65 and older for care, and people probably see a lot of advertisements for managed Medicare. And Summit Medical Group is having a product, and we are trying to team with Delta Dental where we could have an add-on, an added policy or added benefit to the elderly to afford them to have health care, because it is that important.
So it's so interesting here because oral health, right? You would think that it was considered basic, that it would be part of it, but that's not the case all the time.
No. In medical care, physicians do not really treat the oral cavity. We who are trained in ENT, we understand that is extremely important, and we look for oral pathology.
Right.
But gum disease, dental caries do lead to significant issues.
Let's shift gears to employee health. You have said that that being healthy is not as complicated as we sometimes make it, right?
Correct.
You told our producers, eat less, exercise more. It's not rocket science.
Correct.
Elaborate.
Correct. So what I mean by it's not rocket science is that people have to expend or eat 1,500 to 1,800 calories a day. But that's normal.
But doctor, doesn't that have to do with the size of, you know?
No, maybe
I weigh more than you. I want to make a case that I have bigger bones than you. But basically 1,500 to 1,800.
Maybe 2,000 calories a day is what you need just to live, to burn off calories to live.
Go ahead.
Okay? It's easy math. The more calories you put in above 2,000, you gain weight. If you could do some exercise or do something where you burn some calories, if you put in 2,000, you burn 2,500, you burn off 500 calories, that might lead to a half a pound a week. So what happens is that people get upset because they're not losing weight fast enough. They want to really take off a lot of pounds or whatever, and they get frustrated on that. But if you do a sensible diet with exercise, you will lose a half a pound a week, 26 pounds a year. It is achievable. But what happens is that people don't realize there's a lot of advertising, fast food, this, that, whatever. You go and order a bacon cheeseburger, that's like 2,500, 2,000 calories or 3,000 calories right at that sitting.
Well, like that's it.
And it's done.
And how much exercise would you have to do? I mean, how long would you have to be on that treadmill, that stair stepper?
2-3 hours. 2-3 hours.
So that's not realistic.
No, it's not. So you have to really watch your calories. It's really important. And you have to calorie count, but people don't do that, and people cheat calorie counting.
Where's the Fitbit? Because I know did you actually get
Right.
the Fitbit for your team?
So what we did is we gave Fitbits out to the entire employee population of the Summit Medical Group. And we did challenges at work. Who could have the most steps? Departments fed off other departments. And we had a challenge at the group. And it did show that people did lose weight and became healthier and felt good about themselves.
Is there actually an impact in your mind, Jeff? Do you think there's a connection between being healthier, losing weight, and I'm not going to say employee productivity, but happier employees?
Yes, I think there is a huge benefit when you have happier and healthier employees. It is known that your endorphins, these are chemicals that make you feel good about yourself. When you exercise, you produce them, okay? When you feel good about yourself. And then it translates in the workplace.
Yeah. Real quick before I let you go, I didn't ask you to describe, you were on a roundtable with us with a group of other healthcare professionals in our sister program, CAUCUS, New Jersey. I gave you a chance there. But here, Summit is, describe it so people know.
Summit Medical Group is the largest independent physician-owned medical group in the country. We have over 620 providers in 7 counties in the central north area of New Jersey. We also have a management company called Summit Health Management that manages that and also manages other physician populations. Dr.
Jeffrey Benger, Chairman and CEO, Summit Health Management and Summit Medical Group. Jeff, good to see you again.
Thank you, Steve, very much.
One-on-one, we'll be right back right after this.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey, the New Jersey Education Association, Wells Fargo, New Jersey Sharing Network, the law firm of Gibbons, P.C., Verizon, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.